Going to do a welfare check on HCMC. Hennepin County, union workers, patients, all in a battle on the same side, and that is to save HCMC. That safety net hospital is on the verge of closing. I mean, it's in a real crisis after billions of dollars in Medicaid cuts and significant budget issues. Here's Sammy Selena.
A single mom at the time, Krista Steele, considers herself a fighter.
Luna had placed both of her palms on the glass fireplace for like a second or two.
But when blisters formed on her 20-month-old's hands,
They transferred us to HCMC.
she felt helpless. But she watched as healthcare workers at the burn unit, considered one of the best in the Midwest, treated her little girl.
If we didn't get the care that she had gotten, who knows, like if she would be able to draw like she loves to do and dance like she likes to do now. One of the main reasons I did go into nursing, because like I want to be like them. I want to provide this type of care to families.
She's one of the many patients and healthcare workers who provided testimony at the Minnesota Capitol in hopes of saving the hospital.
We have to get ready for the financial storm that's kind of coming and brewing around healthcare.
Jeffrey Lunn, Hennepin County Commissioner, says this legislative session will determine if HCMC closes.
The bill will be introduced and there will be hearings. We've been working with leaders of both parties because it needs to be a purple vote.
With nearly $2 billion in federal cuts to Medicaid reimbursements over the next decade, HCMC is in hot water, already cutting 5 programs, 100 employees, and 100 beds.
We will still have to make about $100 million of reductions if we're successful to get revenue from the state.
So we just cannot afford any more cuts.
Union leaders say there's a higher workload and uncertainty as workers are taking the brunt of the cuts. Negotiations have stalled during a time that's difficult to ask for more money.
We have already experienced years of cuts to wages and benefits.
Many are worried their jobs will be eliminated.
It would be a public health crisis. These patients wouldn't have anywhere to go.
So we show up every shift caring for patients that other systems cannot care for or simply turn away.
HCMC is needed here.
But they say every day they're reminded
Doing my homelessness and doing my medical issues,
why they continue fighting.
this is where I would come.
Well, I want you to know, as I told you before, I come to work every day to help serve folks like
And
you.
I appreciate that.
Yeah.
Sammy Selena,
HCMC is definitely needed.
KARE 11 News.
Indeed it is. Commissioner Lundy said in the next week or so he expects a bill to address the hospital's finances to be introduced finally to the state legislature. We'll have our eyes on it. We'll be right back.